Do you qualify for an Aetna Medicare Supplement plan? Stay tuned, and I'm going to go over all the health questions that Aetna is going to ask you to see if you can qualify for savings with their Medigap coverage. Saving money on your Medicare Supplement plan has never been easier. Nowadays, you can talk to a broker like us here at Senior Healthcare Direct, Medicare Bob's office. We can get your information and help you find the most cost-effective Medicare supplement plan in your area, and we can complete an application with you in less than 15 minutes. Now, if you're new to Medicare, you don't have to answer any health questions. You have 6 months before and 6 months after, if you're new to Medicare Part B, that you're automatically approved for any Medigap plan that you want. However, if you've been on Medicare for longer than 6 months and you decide that you want to upgrade from a Medicare Advantage to a supplement, or go from a plan F to another F, or F to G, or G to N, or F to N, or if you just want to switch your supplement plan to save money and get a better value, you will have to go through medical underwriting. Now, no one has to come to your house and do any lab work or give you a physical, but you will have to answer some health questions. It's our job as your agent to help you not waste time and help be a field agent, field underwriter for the carriers, so that we don't waste the carrier's time by submitting applications, because no one likes to be denied. You don't want to get a denial letter. Plus, the carriers don't want to spend money reviewing applications that they're not going to accept. So it's our job as an agent to ask you these health questions and be well versed to make sure that we don't waste yours or the carrier's time. We're going to take a look at what Aetna will ask you in order to join their Medicare supplement coverage. So the first question is, are you dependent on a wheelchair or motorized mobility device? The second question is, do any of the following apply to you? Are you currently hospitalized, confined to a bed in a nursing home or an assisted living facility, or are you currently receiving any home health care or physical therapy? The next question is, at any time, have you been medically diagnosed, treated, or had surgery for any of the following? And this is at any time: congestive heart failure, unoperated aneurysm or defibrillator, leukemia, lymphoma, cirrhosis, Parkinson's disease, Lou Gehrig's disease, Alzheimer's disease, dementia, chronic kidney disease, kidney failure, kidney disease requiring dialysis, renal insufficiency, or Addison's disease, any condition requiring a bone marrow transplant or stem cell transplant, or any condition requiring an organ transplant. All right, now the next group of questions: have you been medically diagnosed or treated by a member of a medical profession for diabetes? Now, if you answer yes to that question, they're going to ask, does it require insulin? If you answer yes, Aetna will not accept you. Now, what's nice about working with a broker like Senior Healthcare Direct, Medicare Bob's office, is we have over 35 carriers that offer the Medicare supplement plans. Aetna may not accept diabetes with insulin, as we just saw. However, we might have a carrier that does. Another question they have is, do you have diabetes in combination with complications including retinopathy, neuropathy, peripheral vascular or arterial disease, or any heart valve blockage? If you have diabetes in combination with that, Aetna would not accept you. Do you have a history of a heart attack or stroke at any time? So what you're going to see here in our next questions, it's a stroke might be okay with Aetna if it's over 3 years old, unless you have diabetes in combination with that, and then it's if you've ever had a stroke and you're diabetic, they will not accept you. Diabetes and treated with medication that has changed or adjusted in the past 12 months because of uncontrolled blood sugar. So what they're asking you is, you have diabetes, is it stable? Have you been on the same meds for 12 months, at least 12 months? If you switch your diabetic meds, let's say in the last 6, 7, 8 months, because you're trying to figure out what works for you, Aetna's going to say, okay, we won't accept you now, we want a nice 12-month stability. Well, what's nice about that is a lot of carriers require 2 years. So what's nice about our office is by offering multiple carriers, we have this nice toolbox that's available to us so we can find the right plan, right carrier for you that will save you money and get you the best value. The next group of questions have to do in the past 3 years. So if you've had any of these events or diseases in the last 3 years, Aetna will not accept you. But if they're over 3 years, then Aetna would consider. So within the past 36 months, have you been medically diagnosed, treated, or had surgery for any of the following: alcoholism or substance abuse? I'm not great at pronouncing all of these, but cardiomyopathy, AFib, anemia requiring repeated blood transfusions, or any other blood disorder, internal cancer, melanoma, or Hodgkin's disease. So again, if you had cancer 5 years ago, Aetna will still consider accepting you. If you had cancer 2 years ago, They're not. And have you had hepatitis or disorder of the pancreas in the last 36 months? So the next group of questions has to do in the past 2 years, 24 months. Within the past 24 months, have you been medically diagnosed, treated, or had surgery for any of the following? Enlarged heart, transient ischemic attack, so that's like a TIA, mini stroke is what some people call that. A traditional stroke, peripheral vascular disease, arterial disease, neuropathy, amputation caused by disease. So if you've had, again, any of those issues that are over 2 years, then they'll accept you. If it's within the last 2 years, they will not consider you. Myasthenia gravis, systemic lupus, or connective tissue disorder. Osteoporosis with fractures. So this is something that's interesting because I see a lot of agents that even get confused on this. There's a lot of women that are over 65 years old that have osteoporosis. My mom's had it since she was like 42. Osteoporosis alone is not going to stop you from being considered to switch your supplement plan with Aetna. However, if you've had fractures due to your osteoporosis as a result, then they will not consider you if you've had fractures in the last 2 years due to your osteoporosis. Have you had any lung or respiratory disorder requiring the use of a nebulizer or oxygen, or 3 or more medications for lung or respiratory disorder? What's interesting is this is one of Aetna's niches in the marketplace. A lot of carriers will not accept chronic obstructive pulmonary disorder, COPD, at all. If you have COPD, most carriers will not accept you. However, Aetna does, as long as you're not on oxygen and as long as you're not on a nebulizer, having 3 or more inhalers or medications for it. So that's actually a leniency that Aetna has, because most carriers, if you have any type of COPD or chronic obstructive pulmonary disorder, they will not accept you. But Aetna will, as long as you're on oxygen, nebulizer, or on less than 3 meds. Now, obviously, if you have a lung disorder like COPD and you're still smoking, no one's going to accept you, including Aetna. Now, the last group of questions here has to do with the past 1 year. In the last 12 months, have you been advised by a medical professional to have treatment, further evaluation, diagnostic testing, or any surgery that has not been performed, or do you have any pending test results? So why are they asking this question? This is to prevent somebody who may not have insurance to just jump on Aetna's Medicare Supplement coverage because now they know they have something coming up, right? There are people that I talk to every day that they didn't get a plan when they turned 65 because they were healthy, and then now they're 67 or 68 years old, and they just found out they have to get a heart surgery or a stent placement or cataract surgery or a knee replacement or a joint replacement. So what are they doing? They're trying to jump on insurance because now they need insurance to pay for it. Guys, you can't do that. You know, it's just like trying to get car insurance if you just got in a car accident. An insurance company is not going to accept you into their plan if you know you have something coming up. And that's fair to everybody else that's on the plan, because the rates would be much, much higher if they allowed people to just jump on the plan when they needed it and then jump off when they don't need it. So that's why the best time to get a plan on a Medicare supplement plan is when you first join Medicare, because that's the only time in your life you're automatically approved, or while you are healthy and you can answer no to all these health questions. Last couple questions here. In the past 12 months, have you been medically diagnosed, treated, or had surgery for a heart attack, artery blockage, or heart valve disorder? So again, with Aetna, a heart attack's okay if it's over 12 months ago and you're not diabetic. Within the last 12 months, have you been medically diagnosed with wet macular degeneration and have taken or are currently receiving injections? Within the past 12 months, do any of the following apply to you? Have you had a pacemaker implanted? If you're a gentleman, have you had a PSA blood test greater than 4.5? If you're under 70 or with no history of prostate cancer. If you're over 70, has your PSA blood been greater than 6.5? For everybody, have you had a seizure in the last 12 months? And the last question is, was your last blood pressure reading higher than 175 over 100? So those are Aetna's health questions. If you can answer no to all of those questions, then you might be able to be qualified for a Medicare supplement plan. As our agent, we're not the final decision as the underwriter, but we are what's like a field underwriter. We're kind of like a first step to prevent you from getting a nasty decline letter and to prevent the carrier from spending a bunch of money reviewing applications that they're not going to approve. But what's going to happen is once you submit an application, we'll help you do that right over the phone. It takes less than 15 minutes. No one has to come to your house and invade your privacy. It takes 15 minutes, get it submitted. Then what's going to happen is Aetna is going to pull your medication report. Most carriers use what's called GenRE, and they pull all your pharmaceutical data And then they're going to call you, and they're going to, in combination with your application, the health questions that you answered no to, and looking at your medications, they might ask you some of the same health questions that your agent asked you. And then that underwriter will hang up the phone with you, make a determination if you've been approved or not, and they'll notify us and you if you've been approved or not. So it's very important that you don't waste anyone's time and work with an agent like us, because let's say, again, maybe Aetna would not accept you or consider you. Well, we might have a carrier that does. And there's no shortage of great carriers that offer Medicare supplement coverage, and Aetna has been one of the best since Medicare supplement plans started. If you would like some help finding your Medicare supplement plan, Senior Healthcare Direct, Medicare Bob's office will be happy to help you. Our fees are zero. We cost you nothing. The carriers already have all that stuff built into the rates. So the prices to work with us is the same as if you're working directly with the carrier. The few differences are, one, education. We're going to help you understand all the different options: Medicare Advantage, Medicare Sup. If you go with Advantage, HMO, PPO, private fee-for-service, do you want drug coverage in it, all that stuff. If you go with Medicare Supplement, are you eligible for F still? Is G a better value? Is Plan N the right plan for you? High deductible plans. There's tons of Medicare Supplement options. So we're going to educate you on which coverage is the best for you. Then we're going to have options. So we have all the top Medicare carriers. For Medicare Advantage and Medicare Sup, we're a one-stop shop. So if you are interested in a Medicare Supplement and we decide that Plan G is the right fit for you, well, we're not just going to push you into one carrier because that's the only carrier we sell. We're going to help you get the best price for your Medicare Supplement plan that you choose, because we have all the different carriers. And we're not biased on which carrier you should choose. The final reason you should work with us is service. We have no cost to you, but yet you gain so much. Because not only are we going to educate you and get you the most valuable price because we have all the options, we're going to help you your entire Medicare life. What does that mean? That means that we're going to help you get the best price now and the best price every year, because we're going to do annual Medicare supplement reviews to make sure you always have the best price, you never overpay again. We're going to help you with your Part D drug coverage every year. And if you ever have an issue with a claim, we're going to help you. So we have a full licensed support staff that all they do is answer inbound phone calls and help people just like you that decide to work with us. I'm going to drop our phone number, I'm sure is listed in the video. I'm going to drop a link to our website in the description of the video. Please like and subscribe to our Facebook and our YouTube channel so Medicare Bob, myself, I can keep you in the know with everything Medicare.